we're going to do a bit of a question and answer with our midwife. I'll just start off with an acknowledgement of country. So I acknowledge the traditional custodians of the land on which I work and live, and recognise their continuing connection to land, water and community. I pay respect to elders past and present, and I am tuning in from Coogee, which is the Bidjigal and Gadigal people. So tonight we have Sheryl and Chantel here to share a little bit about their experiences with home birth. Sheryl, we'll start with you. Did you want to introduce yourself and give a little bit of a background about your experience in midwifery?
Hi everyone. So I have been a midwife for about 35 years. I got into home birth just as I was finishing my midwifery training, by accident really, and I guess it was just a complete mind-blowing experience to even know there was such a thing. Like back then it was, I don't know, just wasn't as obvious as it is today. So I've been a private midwife for about 33 years and have also worked in the public system at the Women's for almost all of that, apart from more recently a 6-year stint of doing full-time private practice for a couple of reasons, mainly because I was growing 4 children, you know, had 4 kids, I was raising a family and had this kind of, I don't know, moral obligation to be able to offer good midwifery to women that couldn't afford private midwifery. So a couple of years ago, I was asked to set up the publicly funded home birth program at the Women's in Sydney, and we just celebrated our 60th home birth this week in 2 years, which I'm pretty stoked about. Now I'm a grandmother, so I'm just kind of still doing a little bit of private practice, mainly repeat clients, and just kind of easing, you know, this next few years until I don't know when a person feels like they're ready to stop, but yeah, I'm not quite there yet.
Congratulations on being a grandmother. That's so exciting.
Thank you.
Were you at the birth?
Absolutely. We're about to have our third. We'll have our 3rd grandchild. Yeah.
Oh, wow. How was that experience? Was it your daughter-in-law?
2 daughters, yeah. Well, yeah, it's different to looking after. I guess it's just, I mean, for them, they've just grown up with home birth, so they wouldn't have it any other way. But yeah, it's challenging. Yeah.
That's amazing. They would have been so well prepared as you can be, I'm sure.
So yeah, it's a completely normal experience for them. Yeah, that's just what you do.
Yeah, that's incredible.
For any reason you can't. Yeah.
Absolutely. And congratulations as well on those births in 2 years. That's really incredible.
It's pretty. I'm pretty stoked.
Thank you for your time tonight. Yeah, and what sort of things have you got in the plans to keep it going, to keep that evolution and encouragement and support of women in home birth?
So, you know, just lots of mentoring and helping midwives transition from, you know, their role in the hospital to home birth. So we kind of have a 3-tiered system, you know, the novice midwife who's quite new, because at the Women's, the midwives can join a midwifery group practice as a brand new graduate. So those midwives, you know, aren't ready to go to a home birth even just with one other person. So we have, you know, quite a few midwives who can go in that, I guess, preceptor role, who've done lots of home births, and then more experienced midwives who go with them. So we always have 2 midwives. And then the new midwife who goes as a 3rd, if the woman's happy to have 3 midwives there. Yeah. So it actually, like, having attended, you know, hundreds and hundreds and hundreds of home births as a private midwife, I thought it would feel very different. It really doesn't. I mean, it's still, you know, the woman's experience in the home as we know, the first intervention is getting in the car and leaving home. So because that doesn't happen, the babies just come out in the same way as if they had a private midwife. Yes, there are some slight changes, differences. That relationship with the primary midwife is obviously not even comparable to the relationship that they would have with a midwife. That's the only person that they know. Do you want me to go into this, or I'm not sure if you want me to talk about this, or somebody's frozen.
Yeah, Bonnie's
sorry, my internet has been freezing. Yes, it was frozen on you there. Yeah, that sounds great. Yeah, if you don't mind, elaborating on that a little bit.
So when a woman has a relationship with a private midwife, it's somebody that she's chosen, and so it's usually the only person that she sees. So just having that one-to-one care with someone that you have a trusting relationship, you're only getting one lot of information. So yes, that to me is like the absolute gold standard. Whereas in the public model, it's a team of midwives. So there's 5 midwives that the woman gets to know. And she may or may not have someone at the birth who she has a close relationship with. But I guess the main difference is that the woman knows that from the beginning. And quite a lot, well, I don't know, there's been many times where women have rung up to have a publicly funded home birth, and I've strongly suggested that they go private, because when inquiring what their expectations are, having an intimate relationship is very important, and that's definitely not always possible in the public model. The other obvious difference is the parameters of what the hospital guidelines are different to in private practice, despite following the ACM guidelines. Look, ours are great, but women do get cancelled off the program for being ineligible for reasons that perhaps that wouldn't happen if they had their own midwife. But, the water birth rate's about the same. Transfer rate's low. We've had 1 cesarean in 60 births, which is impressive. And about half of those women are women having their first baby. So yeah, I'm pretty stoked. It's a good way to slide into retirement.
You can't retire?
I'm going to have to at some point. It's a funny feeling, isn't it? Like when when the phone rings and I go, once I'm up and dressed, it always feels right. But sometimes the build up is just like, after all these years, like, there's not that much time in 30 odd years that I haven't been on call, through 2 pregnancy, 1 pregnancy, I guess, breastfeed, just all that. It's just, but then when you're there and it's always so nice and it's quite addictive, it's just like, where else would I be? But I guess I just want to be able to say yes a bit more often. Private practice really does prevent you from saying yes to things, or yes, but there's always that provider, if I'm not at a birth. But yeah, it's given me an enormous satisfaction throughout these last 30 odd years. Yeah.
Okay, so Bonnie's just dropped out, so I'm just going to run through with everything with you. So sorry about that. But just coming back to how a home birth is different to hospital overall. Can you give some feedback on, are women still on the clock while labouring and birthing at home? And just giving people an image on what that would be like.
In the public model or private model?
Sorry, we're talking about home birth being different to hospital overall. So one of the questions that came up was
completely different.
Yeah. So are women still on the clock while labouring and birthing at home?
Well, as midwives, we are bound by the ACM referral consultation guidelines. So in theory, yes, we're meant to follow those guidelines, and so women are expected to make some sort of progress in labour.
Mm-hmm.
Um,
And what sort of things are you looking out for in a home birth situation? I know there would probably be some women that are watching right now that might be concerned that perhaps it may not be as monitored. But yeah, can you give some
so
insight
in
onto
order to birth at home, women on the whole are expected to be low risk.
Mm-hmm.
So in a normal birth in hospital and a normal birth at home, midwives just do intermittent auscultation. I guess the most common statement that people make when they don't really understand the difference between hospital and home, and this is just a blanket statement that most people say, oh, well, you know, if something goes wrong, aren't you better off being in the hospital? And I understand why people say that, but it actually is. It just isn't true. Midwives are trained professionals being able to deal with obstetric and neonatal emergencies.
Mm-hmm.
At least, I guess, in a home birth, that's all we know, is being able to deal with emergencies in that environment. And it's actually incredibly rare that happens. And I think it's because, as I said before, moving the woman who's in established labour from her environment, if that's where she's choosing to be, moving her into an environment that perhaps is with, you know, when she arrives, she's got to check in, she's got to go into the room is all bright, the midwife she hasn't met before, you know, all these issues can, and it 100% does, impact on, you know, what we call placental or mammalial birth. So,
Mm-hmm.
Ironically, you know, midwives, when women ring up in the hospital system, try and keep women at home for as long as possible with no support at all, which I've always found quite ironic, because at home we come when the woman asks us to.
Mm.
So, look, you know, this is a question that could literally take hours to answer. But, you know, statistically, it's only ever going to be a small percentage of women that will choose to birth at home. And that the difference between those women and everybody else, in my experience, this is just purely my opinion, women who choose home birth on the whole, and there's always going to be an exception for women who don't fit into, you know, the system and want to birth outside the system. And, you know, I can 100% understand why women choose that. But let's just keep those women out of this conversation for now.
Mm-hmm.
Women that choose home birth are mostly highly educated, have done a lot of research, much more than women who go through the system, who basically just hand over their care to whoever's looking after them, which they spend more time choosing shoes to wear to their wedding or what colour flowers they're going to have. They are healthy, they eat really well, they usually have support. Mostly, I would say like 99% have supportive partners who are on board, and they often are connected with a community of like-minded women. They often will labour and parent the same way. They're committed to breastfeeding. These women are like, they're actually quite rare. It's weird because they're the only women that I've mostly worked with. They're incredibly motivated, and I guess the main difference is they actually are incredibly and genuinely interested in experiencing labour and birth. Whereas a lot of women, I call instead of, they just want to avoid it. The only thing that they're interested in is just having a baby at the end. So how they got there is really not that important. And I'm not saying that that's a bad thing, but that is the main difference, I think, between women who choose home birth. The experience for them is very important. How they emerge at the end of the experience of giving birth, that transformational quality of birth in order to parent their babies, is very important. It's not talked about in Western culture very much, that it's even a thing. You know, it's just, you get pregnant, you go to the GP, you get a referral, you have a baby, you come home. Whereas women who choose home birth are, you know, what's less than 1% in this country, and they're different in that way. And I love working with women like that.
Thank you. Chantel, is there anything that you would like to add to that at all?
I never thought of it like that before, Sheryl, but you're absolutely right. These women that we have the privilege of working with, they are incredibly strong, informed, well-researched women. They know what they want, and they seek out midwives like us who will support them to birth at home. And yeah, they want to experience birth. And the result of that is phenomenal when you look at the difference between hospital and home birth. I mean, I worked most of my career in hospital, both public and private, and seeing how those women enter into labour, how they birth their babies, and how emotionally stable or unstable they are after birth is incredibly different to the women who birth at home. The past 18 months I've spent in private practice, I have seen women emerge from birth powerful and happy and incredibly proud of their achievement, even if that birth has resulted in a transfer to hospital for whatever reason. Whereas the years that I worked in the hospital system, these women who would come to labour ward not knowing who the midwife was going to be, their labour might stop and start again, they might end up with medical intervention. And really, when they came out of birth, they just weren't all that satisfied. And the birth trauma coming out of that model of care is really disturbing.
How often do you see transfers from home births?
Hardly ever. Yeah, well, look, because we take on women who are mostly low risk, we don't see transfers very often at all. I guess the last transfer was, say, VBAC for me, who she was attempting a labour after 2 cesareans, and we transferred for safety in labour, and she had a beautiful birth in hospital. But yeah, there's many reasons why they're transferred. That doesn't really happen very often, you know, because we have low risk women.
Okay, amazing. Thank you so much. Okay. Okay.
Amy, do you want me to?
That is, your internet's all good?
Yeah, I'm back. Thank you. So sorry. Chantel, on that, so what is your advice for VBAC women if they're not eligible to birth through a publicly funded home birth program? Does that mean that they're too high risk?
Well, Sheryl would know that, but I don't think the publicly funded home birth programs will take women who are attempting VBAC. That's just one of their exclusion criteria, and what the hospital system has decided that, you know, that they're not going to accept those women. Look, if someone who's wanting a VBAC, definitely continuity of care with a midwife is, you know, a top priority, whether that's through MGP or whether that's through a private midwife. That's, you know, going to give you your best chance of success. There's other factors when you're considering VBAC, and that's the type of scar, and there's a few other things, but you can talk to your midwife about that when you book in. But definitely continuity of care is the main thing to take from that.
A publicly funded home birth model, women can't have a VBAC, but they can opt to have intermittent monitoring and have a midwifery group practice midwife in the birth centre. That's just at our hospital. I don't think it's like that everywhere. Yeah, women can definitely choose to birth at home with a private midwife and have a VBAC. Yeah.
Are you there, Bonnie? Bonnie has disappeared, I think, again. So in terms of, sorry, I'm just running with it right now, and hopefully Bonnie will be able to join us again in a moment. But in terms of the differences between the publicly funded home birth model and the private practice midwifery model, what are the key differences between those two models in terms of, you know, the women that are able to access them? And I know that that may be different across different home birth programs within the publicly funded models, and that different privately practicing midwives are willing to take on, you know, different women dependent on how they feel. But is there any sort of any generalization that you can provide about that, Sheryl?
I think the main difference I guess it's only from my perspective, is the women's expectation in the public model is, you know, if there's staffing issues or any reason for transfer or cancellation, they don't seem to be that disappointed about it. They kind of just go with the flow. Oh, I'll just come to the birth centre or go to delivery suite. Whereas women who choose a private midwife, the relationship is central to that, to their experience. I think it does make a big difference. And their expectation is that they'll birth at home, you know, unless something happens that means that they can't. So it's not necessarily that they'd be as disappointed. They just their level of commitment is greater, I think, when they've employed their own midwife. And I think the quality of the midwifery is maybe, it's a bit tricky. I mean, obviously, I think the midwives who work in private practice are more experienced in caring for women in a home birth, and their parameters of normal are probably a little bit different to in the hospital. Does that make sense?
Yeah, absolutely. That totally does make sense. Thank you. Because that's a difficult question, or a difficult question to answer, I suppose. And then one of the other questions that we had just ahead of the Zoom chat or the Facebook Live was, what equipment do you actually bring to the birth? And I know that you touched sort of on how private practice midwives and just home birth midwives in general deal with emergencies differently to the way they're dealt with in hospital. But yeah, what equipment do you actually bring along?
It's the same in private practice than it is in hospital.
Yeah.
We bring a lot of stuff that we never use. So,
yep.
I mean, when I open my kit, there's a little bag with a cord clamp and a pair of scissors in it, and mostly that's all I use. But we bring oxygen, neonatal resuscitation equipment, suturing, drugs for hemorrhage, intravenous fluids. There's a lot of stuff that we bring. And the other thing that I think is important is that despite the fact that complications arise so rarely, the Sydney, some of the Sydney midwives, and certainly all the midwives who work in the public system, do skills and drills every year to, you know, keep them updated with all the emergencies that we very rarely get to practice. So I think that's a good thing. Yeah, because it used to be sort of quite hard to be able to access that kind of support in private practice, but it's something that we do at the Royal that I think is really quite helpful. Because sometimes when you're not exposed to those sort of things for a long time, it's, you know, you need to remember how to do them. But because we do them at the hospital, we do them every 6 months. So, you know, unexpected breech, shoulder dystocia, postpartum hemorrhage, and neonatal resus, we do those drills every 6 months at the hospital.
Yeah, and I think it's really helpful and important to point out the differences between midwives that are providing home birth care versus those that are providing care within the hospital system, in terms of, you know, what's required of them and all of the hoops that they have to jump through in order to maintain their practice and, you know, registration and be able to practice as a privately practicing midwife. Or I don't know if it's the same for a publicly funded home birth model. I imagine it would be. It
is, because I ensure that happens.
Yeah, awesome.
Yeah, because I think it's important. I mean, in private practice, I think we're over-regulated, to be honest. But that's a question for another day.
Yes, that's a whole different kettle of fish, and we could talk on that for 3 hours alone. So another question that was brought up ahead of time was, what does transfer look like in an emergency versus a non-emergency situation for women that are birthing at home?
Oh my God, it's so rare that you transfer in an emergency. Like, it's incredibly rare. Normally it's the most common reason, I guess, would be, and it's the same in both private and publicly funded models, it is just slow progress in first stage of labour for a woman having her first baby. And that can happen in their car. It's kind of no different than just going to hospital to have a baby. The only time we use an ambulance would be for, and this doesn't happen very often, would be excessive bleeding after the birth. So you transfer the woman by ambulance, but even then you manage that at home first and then transfer, because midwives are, you know, trained health professionals to be able to deal with those emergencies at home. And so I guess with private practice, you have to think, you know, is it okay for me to leave this woman overnight without a midwife there? No, it's not. So we should transfer and she should stay overnight and then come home the next day if the bleeding's excessive. But again, you know, when we look at the statistics between women that birth at home and women that birth in hospital, all of those issues are less bleeding, less babies needing to go to the nursery, less perineal trauma, less postnatal depression, a higher normal birth rate. All of the comparison between women, if you take the same cohort of women who are going to the hospital to have a baby versus those women having a home birth, statistically in Australia, you're safer staying at home.
Yeah, absolutely. And I'm really grateful that you touched on that, because when the research really supports home birth as a safer model of care, not just safe, but safer than birthing in a hospital system. It doesn't make sense that our system doesn't support it adequately, realistically.
Definitely, the system does not support it. No.
And women
that information is really hard to find for women. It's hidden, you know. They have to really, really dig, and they usually have to know someone, you know, who's had a home birth. So there's even the outcomes for publicly funded home birth still much, much better than women who birth in the hospital, being cared for by the same midwives.
Yeah, absolutely. So Bonnie, are you back?
I'm back. I switched to my mobile. Fingers crossed it will work.
Awesome.
Sorry everyone for being so disruptive. I've been in and out, so thank you, Sheryl. I'll keep going with the questions that we've got that have been sent through. So if you've got anything to add, just jump in. So someone has asked, what happens if my baby isn't breathing? And I know that you've just said that these things are so rare, but if that was to happen, what would be the procedure?
Would you want to answer that, Chantel, so that we don't have to keep listening to my voice?
Sure. So sometimes when babies come out, they aren't breathing straight away, but they're still connected to their cord and their placenta, and they're still receiving oxygen while that cord is still pulsing for quite a few minutes after birth. So for one thing, if baby doesn't come out breathing straight away, that's okay, because they're still receiving oxygen. And private midwives are very good at resuscitating babies. We've had lots of practice, and we have lots of techniques to help babies, and that might just be rubbing baby on their back. Like Sheryl said, we carry oxygen tanks and neonatal resuscitation equipment and Letertre bags to help them breathe for a little while if we need to. And 99.9% of the time, all they need is a rub on their back and maybe a little bit of oxygen, and you know, and they're absolutely fine. Babies are designed to transition to the environment outside the body, and sometimes that takes a little while, and that's okay.
Exactly. So there'd be nothing different about the process that would happen at home to compared to what would be in hospital, and nothing that's available in hospital that wouldn't be in the home birth.
Well, it's actually quite interesting, because in hospital, when it happens, so a buzzer is pressed, and the midwives, this is not a criticism, it's just the way it can be, particularly in a big tertiary referral hospital, wait for the paediatrician to come. Whereas at home, because we don't have that, we're actually really good at resuscitation, because it's always left up to us. So, and the cord, because of the design of the resuscitation equipment location in a traditional delivery suite, the only way that you can gain access to the equipment is to cut the cord and move the baby away from the mother, which never happens at home. So it's just, it's worth noting that resuscitation at home is usually more successful for that reason, because we don't cut and clamp the cord. We resuscitate the baby on the mother.
Usually in the swimming pool or in the birth
Yes.
Yeah, so lovely. I'll just open it up to the floor. Is there anyone that had anything to add or any questions just regarding the topic of safety that they wanted to raise? You can pop your questions in the chat, so you don't have to come in. There is only 6 of us though, so don't be too scared. Or you're free to pop your mic on and ask in at any time. We've just had another. It does jump back a little bit, but I do want to ask you, Sheryl and Chantel. Someone said that they're just finding it really difficult to find concrete answers on home birthing in Australia in regards to what it costs, how to organise it, where to get information from. What are some of the resources that you can point people to that want to, don't know anyone or anyone in their close circle that has home birth? Where would you start?
Chantel?
Well, Homebirth New South Wales has just updated their website, and they have a comprehensive list of private midwives. Yes, thank you, women, over New South Wales. Publicly funded ones, I don't know how they're advertised. They might be on that website. You might be able to enlighten me, but I know that the Royal Hospital for Women, Westmead and Wollongong all have publicly funded home birth programs. You need to live within a certain radius to be able to apply. And but yes, onto that website, and all the midwives who practice privately are on there, and you can contact them and ask them if they're available. We do get booked out fairly quickly. So as soon as you're pregnant, please contact us.
There's definitely a shortage of privately practicing midwives. Yeah, and that's a conversation for another day as well. There's reasons for that, but yeah, it's a shame.
So you have to have a privately practicing midwife at your home birth as well as someone from the hospital. Are you employed through the hospital, or you're running your own business?
They're the 2 choices, yeah. Yeah.
Okay.
Or free birth, where women don't have a midwife there.
Okay.
So private midwives are not employed by the hospital. Some of us have visiting rights associated with Westmead Hospital. So if we have women who wish to birth in hospital, or they wish to have the backup of a particular obstetrician, and if on transfer have your private midwife caring for you in hospital, then that's an option. But no, we are self-employed, whereas the lovely midwives that Sheryl works with under the publicly funded home birth program, they're employed by the hospital, by New South Wales Health.
Yeah.
And what are the costs associated with home birthing?
So it varies, and sometimes it varies because of distance. But I think you'll pay between $5,000 and $7,000 for a private midwife, usually with about $1,000 to $1,500 back from Medicare, depending on safety net and the amount of visits and that sort of thing. We wish it was less. We wish there was a Medicare item number for birth, but we're all working on that.
Absolutely, exactly. And it just takes more people to start it, and for that advocacy and awareness to get around, doesn't it?
That's right. It does sound like a lot, but we pay our own indemnity insurance, our own equipment. We don't get suturing equipment and drugs from the hospital. We have to purchase all of those things and pay our travel and our, birth pools and everything. So unfortunately, there is a cost of home birth, and we wish it wasn't for you women, but at the moment, that's the way it is.
Absolutely, Chantel. And I think it's so important to have that awareness around where the costs come from, and that can, help to reconcile with that. So you do bring your own pool?
Yes.
You come with pool?
Yes. All my women have access to a birthing pool and a liner, so they can have water birth at home.
Fantastic.
Also, really, I just wanted to jump in and say, in terms of the support that private midwives, and most likely through the publicly funded hospital model as well, but with private midwifery care, you are paying for it, but you actually get an incredible amount of time with your midwife, and the care is just amazing. So if you consider the amount that you would spend on obstetric based care, you would be paying at least what you would be paying a privately practicing midwife, typically quite a bit more. And the appointments are maybe 15 minutes at most at a stretch. Whereas with a privately practicing midwife, you can sit with them for an hour, sometimes even 2. They listen to all of your questions. They are on the end of the phone for whatever you need. They're on call for you. They're not going to just be like, oh, sorry, I went on holidays. I'm not there. You're just going to have the backup.
We never have any holiday.
No, exactly. So you're paying not only for the birth, for birthing at home with the care of the privately practicing midwife and everything that comes with that, but also their support throughout the pregnancy, and then also postpartum. You have, as many visits as you really need, up to 6 weeks postpartum. And I just think that is so valuable, and it's something that's not really, I suppose, talked about enough in terms of the value of privately practicing midwifery care, because well, I don't know why it's not spoken about, but I found that for my first baby, I did birth in the hospital. I didn't get to have the home birth I wanted, and the care before and after, I would have paid more than what I was paying anyway just for that. So yeah, it really is the gold standard of care.
Yeah, especially that aftercare for the 6 weeks when it's just so isolating and you're just completely in a whole new world. So yeah, definitely. On to some of the practicalities. So just because I just touched on a water birth, I'm keen to hear your thoughts, Sheryl and Chantel, on a water birth versus a non-water birth, and what some of the advantages can be. It hadn't even occurred to me that a home birth might not be in water, but someone just asked that. So
on the old days,
so
we weren't doing as many. What would your water birth rate be, Chantel?
Oh, I've had one woman maybe in the past 6 months not have a water birth, I think, who plan to have a birth at home. Like, everyone births in the water.
Yeah, or if they don't, it's because it was happening too quickly and
Yep. Or if there's been
water.
transfer, or if I've had a woman who's had a breech birth, yeah, those sorts of reasons for not water birth. But no, a straightforward cephalic baby at home, 9 times out of 10, it will be in the water, because it's pain relief. It's everything. If anyone who's ever laboured in the water and then gotten out of the water gets back in very quickly, it's it's the pain relief of home birth.
Yeah, absolutely. And on that, so what are some of the things, so if you're planning on having a water birth at home, what are some of the things that you need to think about in terms of setting up for a home birth?
I'm always really intrigued on Home Birth Australia Facebook page, women asking that question, but your midwife goes through all that with you. She either provides a liner or gets you to buy a liner. She goes through what kind of tap connector. I have like what called my plumber's kit that I have in the back of my car with, shifters and all the different attachments that you'd ever need. And I make sure that's all sorted by 36 weeks. And that's really because, not doing that, you risk it not being organised on the day, and then it's going to be me who's going to be ferrying buckets backwards and forwards, and I don't want to do that. So the only thing I get the clients to buy is a hose, because I used to have a dirty and a clean hose. It just is too confusing. And buying a $7 hose is not going to kill anyone. I mean, you can have a reusable hose that you fill with, but if you're going to empty the pool with a hose, you've got to have a dirty and a clean hose, obviously. But yeah, the midwife always organises all that. I mean, I don't know why anyone wouldn't. Why a midwife wouldn't set all that up beforehand.
I guess we're just conditioned to think that we go to a place that's set up and established for this to happen, and then birth is, you know, projected as such a messy experience. So the thought of having it in your home might be, I think, just instantly is what people think. Is there a lot of mess? Like, who cleans it up? Where does it all go? No. I've heard people say that, you know, they afterwards their friends wouldn't come over because they were like, oh my god, it must look like a murder scene. But she said there's just nothing anywhere. It's just so clean and everything is taken care of.
You know, we provide a list of things that women, I call it my suggested supplies list. And we go through the suggested supplies at the 36-week visit and, you know, tick off, because not women having their second or, you know, other baby don't need everything on the list. One of my things that I'm in love with that I actually got from Nikki Leap, that's an essential thing on the list, is the granny pants. I don't know whether you use them, Chantel.
Oh, yes, they have come in recently. They are, yes, in fashion.
Pull up adult nappies, we call them granny pants. So they are a must, because when you get out of the pool and the placenta's born, you just pop those undies on and you can sit anywhere in the house and you don't make a mess. They're way better than pads. You only need one packet. You know, the women always roll their eyes and go, I don't want to get them. I go, trust me, you too will love the granny pants. And afterwards they're going, I love the granny pants.
Save on washing. Why not?
Mess. Are a must, because. Sorry?
Did someone else jump in there? Do we have another participant?
No.
Okay, so no mess. So what goes on the floor?
Plastic.
Yeah, or a painter's drop sheet, tarp, any of those goes under the pool and on the lounge. You get some old sheets and towels. You know, we do all the pack up at Homebirth. So
we clean everything up.
That's right.
That's amazing. So you're just
there
to get to bond with your baby.
Beautiful baby on her chest. She's breastfeeding. They're all staring at this gorgeous baby. Us midwives are in the background, putting down the pools, getting the drop sheets, putting the towels in the washing machine, putting a load on. It's all done.
Gosh, that is enticing. And what about if you live in a second-story apartment or you want to birth on the second floor of your home? How heavy is it? Is it?
Oh my God,
it's in the water birth, of course.
All the time. Okay, so a normal birth pool weighs 450 kilos when it's full of water, which is about equivalent to 7 adults standing together. So,
which would happen outside of COVID potentially.
You're never going to say, oh, can you spread out because you're all standing too close apart from COVID? You're going to make a hole in the floor. Yeah, it's not a problem at all.
Fantastic. Okay, so you can birth anywhere, any height. That's great. What about letting your neighbours know? Do you advise people to let that?
I don't. It's up to them, I guess. Do you, Chantel?
No.
Look. A couple of weeks ago, we did have the police come to the door, but that's the first time in a long time.
I've never had
the police.
Because the woman I wasn't at the birth. The woman was saying, help me, please, help me, which is unusual. And this is the thing that we've noticed. I do notice more since COVID. Some of the midwives and I, you know, we get together quite regularly, and we've talked about the increase in women wanting to have a home birth. We're calling them COVID babies, even though they're not really a COVID baby. Women who are seeking out home birth for reasons that are not bad, they're just different. So perhaps their level of commitment's a little bit different. So, you know, they didn't really know about home birth because they were booked at the hospital, and then they were told they couldn't have more than one support person. So oh, there's a little baby. Is that your baby? Sounded cute. So, you know, perhaps because it's unusual, most home birthing women are not that noisy, but this particular woman was. It was coming very quickly, and anyway, then there's a knock on the door, and there's, I think, 4 police officers at the door, and the midwife just went and said, no, but there's just a baby born. They were like, oh, how exciting! Oh, how lovely! Okay, bye. It was very cute. But with all the births that I've been to, I think that's the second time it's ever happened. Some people, they live like in a big high-rise block of flats. I had one woman that put like a little note in the lift, just said, don't freak out in unit number 9. We're just having a baby. But most women don't, because if a woman's woman's giving birth, it should sound like they're having really great sex. That's how it should sound. And mostly it does. You know, it's unusual that women are like so noisy that it sounds frightening.
No,
We
you
just
don't tell your neighbours when you're having sex. So
you know, they might say, "God, we could hurry up." Forever.
If you haven't let them know 9 months before, there's no need to let them know now.
I was wondering if I might ask a question. I'm just a person in the random world.
Please.
One of my big concerns was a breech birth, because probably at least 10 of my friends, close friends, have had babies, and only one was allowed to have a natural birth because all of the others were breech, and they were only allowed to have C-sections. And when I contacted a couple of my local hospitals, I'm actually in Victoria, they said under no circumstances would they allow breech births. What is the policy for home birthing and breech? Because the midwives I've spoken to have said they're fine with it.
Chantel?
We shouldn't be planning breech at home. It's outside the guidelines to plan a breech birth at home, because there's a higher chance of, you know, things not going quite the way you plan. The babies can get stuck. Babies might need more resuscitation than a normal head down baby. So most of us, it would be hard to find a midwife who would support a woman having a breech at home. However, often if it's a woman third or fourth baby, there might be an accidental breech at home, and that has happened. And, you know, of course, we're not going to leave you or put you in an ambulance with a baby half out, and we would support you safely at home. But yeah, for women who have a known breech in late pregnancy, we would encourage them to birth in hospital, and we would attend with you. And for someone like myself who has visiting rights, I would go and care for you along with my partner obstetrician, and we can, you know, make it as home-like as we can, and not have a million people in the room and the lights dim, and, you know, a beautiful birth. But yeah, most of us don't plan to support a woman with a breech at home.
Thank you. And are there any possibilities for a vaginal birth with breech babies in a hospital setting with a private midwife?
Absolutely, definitely.
Yeah, that's what Chantel just said. Yeah.
Yeah, at Westmead. So certain hospitals won't do it. They won't support it. Their medical staff don't believe in it. They just are scared of it. They're not trained in it. But there are definitely leading hospitals in Sydney, like the one where Sheryl is at, and Westmead, where I have visiting rights at, who definitely would happily support a woman having a vaginal breech and have trained professionals and everybody there to support her.
Yeah, can I say it's pretty shit, really, that an obstetrician can train to do all those years of training, and when they have a woman that has a baby that's breech at term, says, "Oh, I'm sorry, but I don't know how to do that." Can you imagine?
I live between the two tertiary hospitals in Victoria, in Melbourne, and both said no, under no circumstances.
Go and learn how to do it if you don't know how to do it. I mean,
Right.
yeah, it's mental. You
Yeah,
have,
it's disgusting.
I mean, most hospitals, I don't know what it's like in Victoria, but it's a bit hit and miss. Yeah. In Sydney, it's fine. I don't know about other states, though. I mean, we've had women come to the women's to have a breech birth from other states, but that was pre-COVID. They've actually moved here because they've been that committed to it. Yeah, it's pretty appalling, really, that an obstetrician that you're paying $10,000 can say, "Oh, I don't do that." Yeah.
Thank you. EC, does that answer your question? Did you have anything else that you wanted to
Thank you so much. No, that's
At the
perfect.
bottom, I wonder if has anyone been monitoring the questions?
Yeah, I'm just going to ask some now. Okay. How would an emergency handle during the home birth if a last-minute emergency situation arose, such as a cord prolapse or other cord issues?
Can you not? Okay. Yeah.
Fetal distress requiring urgent surgical intervention. How would that be taken care of? And we sort of touched on it before, but just yeah, if you could sort of.
Well, I mean, I don't want to say never, ever, but the things that cause fetal distress are usually intravenous syntocinon, epidural anesthesia, all the medications and drugs that are used in, a medicalised birth. It just, in a spontaneous labour, touch wood, it just doesn't happen. Well, there was sort of a couple of questions in there.
I guess it was more
because we
just...
very, very, very rarely rupture the membranes at home. We would only do that if the head was really well down. Cord prolapse is incredibly rare. It normally, even though it's rare in hospital, it happens during the induction of labour process when the head is high and someone's trying to hold the bum down, and they, there's a gap there, and that's when it happens. But obviously we don't do that at home. Yeah. I mean, you can never say never, but yeah, that's never happened to me in, so many births.
And we don't wait until it's a big emergency in home birth, because like Sheryl said, there's no intervention in home birth. We're not breaking people's waters. We're not putting up IV syntocinon. So when something starts to go off the beaten path, when labour starts to look like something's not happening, it's glaringly obvious. And if there is any fetal distress, we're going to act on that really early, and we're going to transfer really safely. We're not going to wait right until the last minute, until that baby's super distressed and we're putting someone's life at risk. We're very good at diagnosing when things aren't going well, and then we safely have a conversation with the woman and her husband about how maybe we are concerned and maybe we're better off in hospital, and off we go very calmly. There's no need to panic, and that's home birth. It's great communication is the key there, and good safe care.
Yeah, fantastic. Thank you. How would you find, if you live in regional Australia and there's only one midwife in 150 kilometre radius, what are your options for a home birth?
We'll talk to that midwife first and see what she says. But we have had women come and stay at Airbnbs in Sydney and birth there. And, maybe there's a way we can work out care with that. If there's a midwife in the area, she can do the antenatal care. I'm sure she must have a way of having a second midwife from the local hospital. There's ways. Talk to the private midwives, get on Homebirth New South Wales and talk it out with them.
Fantastic. Yep. Seek it out. That's a great suggestion. Does previous hypertension in pregnancy rule you out for home birth?
Unless the woman has essential hypertension. But if it's pregnancy-induced hypertension, it would be unusual to get it the second time.
Simple. Thank you.
If you change partners, maybe that could increase the risk, but normally it would tend to be more women having their first baby, or women that have other sorry, one of my clients is messaging me, laughing at me. When somebody said cord prolapse, I went, ooh. You're funny. I guess it happens less because the cohort of women choosing home birth usually very healthy. They have a healthy diet and they don't have other sort of comorbidities. Yeah. You've got to be healthy.
Jess has said that she's had hypertension twice and this is her third. So third pregnancy and third hypertension diagnosis, Jess?
So she might have essential hypertension, which is quite different. So it exacerbates it. But it's different to preeclampsia.
So I'm only 10 weeks, so it's too early to know. But yeah, basically the local hospital told me I'm too high risk for caseload, 2 hypertensive pregnancies. I have to have a doctor.
And whereabouts do you live?
I would go to Westmead, but we're moving to Darwin in 6 weeks.
Oh, so it might be. See, some midwifery group practices have what we call all risk. They care for women who aren't just low risk.
Yeah.
So women's where I work, we look after women with hypertension, with twins, with VBAC. It's not just low risk. So
Yeah.
it might be worth ringing Darwin and seeing what their caseload
They
midwife.
told me I was medium risk. I didn't fall into either category for them.
Did you have to be medicated the second time?
Both times I wasn't medicated until birth.
Hmm.
So I was given, my first dose was when I was induced with my first, and then I wasn't medicated until I ended up back in hospital 5 days postpartum with my second.
And you developed hypertension then?
Yeah. So I was
And
fine.
no hypertension when you're not pregnant?
No, I'm perfectly fine, normal, bit overweight, but otherwise healthy.
That's interesting. It might be different in Darwin where they have an all-risk caseload. They might look after women with all risk, yeah.
They have private midwives up there. As far as I'm aware, they don't. They do have home birth, but it's a hospital-funded one.
I don't know.
I'm not sure.
I'm worried I'm going to be too high risk for them to do home birth there.
Maybe just have a chat to them when you get there, Jess, and just
Well, I wasn't moving till
centralised.
December, and we found out we're moving in 6 weeks today. So
wow, it's a nice part of the world.
Yeah, double congratulations.
Thank you.
Amazing.
Yeah, good old military.
Okay.
Right.
So,
All right, we've got a few more
in
questions.
terms of private midwives in the Northern Territory, there aren't any that are able to practice, and I think that was because there was legislation preventing them from actually practicing in the Northern Territory. So there is the publicly funded home birth model, but there's no private midwives, unfortunately.
All right. Well, I will do my best to talk my way into that then.
Yeah, because I mean, if you don't have hypertension now and you don't develop during the pregnancy, then you're still considered low risk.
Yeah, that's what I thought too. So
It doesn't really sound like you had it the second time. You had a rebound hypertension 5 days after having the baby?
Yeah, it was extremely high blood pressure though. It was 180 over 110 or something.
And how long did you have to? Oh, anyway, that's just
one. It wasn't very long, a couple of weeks, and then I was weaned off.
Right, okay.
I've been on it more than 6 weeks.
Right. Oh, good luck with everything, Jess.
Good luck, Jess. We've got everything crossed for you.
Thank you.
Thanks for asking.
Take a doula with you to the hospital if that's your only option. And you'll have that continuity of care and that spiritual guidance and that beautiful feminine support. And
yeah, that's a good idea, actually. I hadn't thought of that. That's really, yeah, that's a good idea.
Yeah.
All the best.
Great. Doulas are the best. Thanks, Chantel. Another one for you, Chantel. Eddie has asked, if you end up going to the hospital with a private midwife with visiting rights at Westmead, are you admitted as public or private patient?
Private, that's a good question. So if you don't have private health insurance with hospital cover, you will incur hospital fees, and for a one-night stay, that's up to about $2,400. So it does, using visiting rights does come with a cost, and we hate that too, but yes, you are considered private.
Okay, and there can be some benefits to the private stay as well, those nice suites.
Well, yeah, you get your own room, but I guess the most important part of being admitted private is that when you're under myself and Dr. Martin, the obstetrician, nobody else comes in your labour room because we are the people that are doing your care, and we're directing your care along with you. So there aren't 50 midwives and different registrars coming in. It's just us. So it's we make it as like home as possible.
And yeah, not having so many different people interfering and having to answer the same questions all the time. That makes such a difference. Now I've got 2 questions. They're not positive questions, so I need someone to come up with one positive point or question to finish on just before we go. So, Alicia, is yours positive?
Yeah. Positive.
Okay, I'll save it for last. I'll just go through these and then I'll come straight back to you. Is how often is fetal distress monitored in home birth?
That question doesn't make sense.
How often does it happen?
Yeah, how often does it occur? How many births would you have witnessed it in?
1 in the past year, 18 months.
Wow.
It's very, and that it's
I
very,
don't think I've ever
very
had to
rare.
transfer for an abnormal fetal heart rate pattern.
What about just observing it in the birth?
I'm not sure what you mean, Bonnie.
Well, it happens in the hospital because you're having directed pushing, and if you're talking about happening in the birth, and so people are telling you to hold your breath and push, and that's kind of that pushing action stops oxygen going to the baby, and that causes fetal distress. That doesn't happen at home because we don't do that. Women, they push. It's called physiological pushing, and their body naturally pushes out their baby with breaks in between, and there isn't that stress on the baby of forcing it out. So we don't see it. That's not what we do.
Sorry, that was actually my question. What I meant to ask is how often it is monitored. In other words, every 20 minutes?
How often do you monitor? Oh, yes. I see what you mean.
Fantastic. Thanks for clarifying.
That's okay.
So every 15 minutes in active labour, it's exactly the same as if you're in the hospital. Yeah. We follow the New South Wales Health guidelines for that. So in active labour, every 15 minutes. In second stage, when pushing, every 5 minutes. And more often if it's needed. But that's the standard, and it's the same hospital or home.
And if I understand correctly, in hospital they use, or maybe in some occasions, they use, is it electronic?
Like continuous monitoring?
Yes. Yeah. So you don't do that?
No, if there was a reason that a woman needed continuous monitoring, she shouldn't be at home. You would transfer if the woman needed to be continuously monitored. That's the essential difference.
Right.
But you have the Doppler, don't you, that you would checking the heartbeat? Yeah, so that's what you do every 15 minutes.
Yeah.
And if the heart rate drops, then that is a cause for immediate transfer.
But it doesn't tend to happen at home.
That's right. We don't see
women. They're upright. They're not sort of on their back in the bed. Very rarely, women very rarely adopt that position of lying on their back in bed.
That's right. And we're not inducing labour. We're not forcing anything. So these babies, they're not distressed at home.
Right.
Yeah.
Thank you.
Thanks, Lana. One more from Facebook. Are there signs of uterine rupture in advance? Is there time for a transfer to hospital in the case of catastrophic rupture? How rare is it?
Very, very rare. And there are, of course, lots of warning signs when we're looking, if someone's, I'm assuming you're talking about VBAC and we're talking about uterine rupture. I mean, the chances of that are so rare. And yes, there are warning signs. The baby's heart rate might drop, like you're talking about fetal distress. That's a sign of uterine rupture, pain in between contractions. There are lots of things that midwives are trained to look for. And yes, we wouldn't wait for catastrophic rupture before we transferred. There'd be early signs, and we'd be looking for those vigilantly.
Fantastic, thank you. Elsia, we'll get you to kick off any questions from the floor. Thank you.
Thank you, guys. This is a bit of a long-winded intro to ask the question. So a lot of the birth books I've been reading, like Rhea Dempsey and others, have focused on how to succeed at birthing in hospital, even though it's evidence-based not to be the best place for low-risk women. What I'm wanting to know is, aside from watching home birth videos that only show snapshots of what happens, where can I find out more about like how the typical home birth goes and what some women choose to do in early labor? When's the best time to call my midwife? And as a first time, I'm 33 weeks and this is my first time doing a home birth. I'm really like excited, but also I'd love to know like a bit more about what even happens. Yeah.
Listen to Australian Birth Stories podcast. Just keep listening to positive birth stories. You could read Spiritual Midwifery. It's all written in the 70s, but it's all the same. Surround yourself with people who, think and feel like you do. Join an online group or a women's group in your area of other women who've had a home birth. I mean, your midwife will know when's the right time for her to be there. And we never mind having calls. And sometimes we do say, oh, it's a bit early. We'll come a bit later. And if the woman still wants us to, we would still come, and then we may leave if it's too early. Birth's it's so different for every single woman. You can't say because it's a woman's first baby that it's going to take a prescripted amount of time. You know, sometimes we're surprised and it's very quick, and other times it's long. You know, everyone's different. Yeah.
Awesome. And do people just like move between like places that feel good, like it, and you can just do that?
Well, for a start, you don't ask permission for anything because you're in your own home. So you just, I mean, occasionally the midwife might make suggestions like, you know, you've been in the shower for a long time, you know, do you want to try something different? But usually the woman, I kind of find that women go into kind of a very deep trance-like state and they're not really communicating or talking. And we just follow the woman's lead. Okay. Yeah. Does that make sense?
Yeah, it really does. And I think that was, I guess, the crux of it is like, am I leading this? Like,
well, you and your baby are.
Yeah.
And kind of no one's in control. It's actually the opposite.
Mm.
It's all about surrender and trust.
Yeah.
It sounds so corny and cliche, but that is exactly that. And literally the baby is either going to come out or it isn't. It's as simple as that. And if it doesn't, we go to hospital, but mostly it does. Yeah.
So it always is. It's coming out.
It'll always come out one way or the other. You won't feel like that when you're in labour. You'll feel like it's going on forever. But I mean, here's a thing to consider, that you could actually be in a coma and your baby would still come out. So the secret is just disconnecting from here. So if you're a Labrador having a litter of puppies, she doesn't go to calm birth and read Innes and Aimee Sing because she doesn't have a neocortex that's saying to her, well, that one hurt. I wonder if I should have chosen something different like an epidural. I mean, that's just me being a bit silly, but the main difference between any other placental mammal and us is, you know, we have a very, very well-developed frontal lobe that potentially interferes with our ability to produce all those hormones that make labour enjoyable. I mean, obviously we're doing something right because women don't ever just stop at one. When they're in the middle of it, they might think, well, that's it. Many women say that, I'm not having another baby, but afterwards, they always say, whether it's, you know, at that moment or the next day or the next week, they go, that was the best thing I've ever done. They always say that. I want to do it again.
At home they do.
Physiological birth is addictive. It's actually
like
addictive.
The biggest trip ever. You don't really need to do anything because your baby just comes out.
Thank you.
Amazing. Do you feel better, Elsia? Is that answered? Awesome. Are there any other questions from anyone in the Zoom?
There was one that came from Facebook, which was, has COVID made any changes around home birth and in like the private models and in publicly funded models?
Was this an increase really and more women having home births? Yeah, have you found that too, Chantel?
Absolutely. We're all fully booked until, you know, April next year. It's crazy.
Harriet, we've got you and your family online, I think. That's such an incredible, unexpected outcome. I'm so happy for you.
You're on mute.
Was there any...
Sorry. We've just got one more. How long will a first-time mum be allowed to labour at home in active labour if both mum and baby are well?
Can we not use the word allowed?
Yeah.
Choose to.
we don't time labor as long as there's progress, and as long as mum and baby are well. You've answered that question yourself.
Because some babies take a while to turn around. You know, they might come into labour in a weird position. They need to rotate. You can just, I don't know, like, you just know that whether it's okay or not. And it's hard to describe. It's just, when a woman's not progressing, everybody that's in the room feels it when the progress is abnormal. There's just a feeling of, this is not working. You know, and there's things that we try, and if they don't work, then everyone is feeling that, okay, we need to use the technology that's available. And that, you know, sometimes that does happen, but it's not just a like spur of the minute decision, right, this is not working, we need to go. Because as labour progresses, the people that are in the room, it's hard to describe, you feel the progress in your body. And when the progress is abnormal, you feel the opposite. Yeah, it's hard to describe without sounding a bit kind of esoteric or something. You just feel it.
No, I think that's exactly the sort of wisdom that we need to know that home birth holds. That's, yeah, exactly the way that women desire to birth. So I think that's beautiful. If there's no more questions, Wendy has said, thanks for all the info. I love that both of you have such a positive outlook about home birth. It's very refreshing, and I have to agree. Thank you so much for all of your wisdom and knowledge and your openness and sharing with everyone so openly.
Oh, pleasure.
Thank you.
I have one quick question. How often do you see women breastfeeding during labour? Is that rare or?
No, I've definitely seen that.
Yeah, like a toddler, you mean? One of the?
Well, I'm 10 and feeding my 4 and 2-year-old and pregnant. 4-year-old's almost weaned. But I didn't get to breastfeed him as much because I was in hospital last time, but it really made labour go really quick.
Yeah.
When he was there, it went from like 40 minutes to 10 minutes to 5 minutes. It was fast with him breastfeeding.
Great. Go for.
Yeah, I've definitely had women, who've breastfed in labour, and then as soon as the baby's out, the 2-year-old might climb into the pool and feed on one side where they feed the newborn.
Yeah.
Yeah, I just didn't know if that was a common thing or not.
I wouldn't say it's common. It definitely does happen. I've had women who said afterwards, wish I'd weaned the 3-year-old before the baby, because they found it was hiding in the bathroom so they could feed the newborn.
Yeah, I know that feeling.
100%.
As long as my eldest is weaned, I don't mind feeding 2, but not 3. That's a bit too much.
Superwoman.
That's an incredible effort. Awesome. Okay, well, I think we will leave it there. And yeah, thank you again, everyone. And any extra questions can be sent through to Homebirth New South Wales. And if you would like to get in contact with Sheryl and Chantel, you can find their information on our website as well. And the recording of this will be saved. So if you would like to share it with anyone, then please just let us know.
Awesome.
Thank you,
everyone.
Thank you all.
Thank you.
Night.
Bye.
Bye.